Good afternoon, everyone. Welcome to FREDLA's Learning Community for Family Leaders. We are expecting a large group of people on our webinar today. So we're thrilled that you're with us. My name is Jane Walker, and I'm with the Family-Run Executive Director Leadership Association, often referred to as FREDLA. We see lots of people from all over the country, and if you haven't done so yet, please use the chat box to introduce yourself and let us know where you're from. Throughout the call, you are also welcome to make comments and ask questions. We really hope you will. We'll be tracking your questions and answer them at the end of the call. This webinar is hosted by the Family-Run Executive Director Leadership Association. We are a partner in the National TA Network for Children's Behavioral Health that is operated by and coordinated through the University of Maryland. In case you're not familiar with FREDLA, we are a national organization, a network of family-run organizations and family leaders dedicated to building leadership and influencing policy on behalf of our families and children with mental health needs. Our learning objectives are here on the screen, and they are to be able to identify core principles for meaningfully engaging families, learn evidence-informed practices for engaging families in child and youth mental health care, and exploring methods for engaging, supporting, and retaining family experience and expertise in 3 key arenas. Today, we're very fortunate to have Pat Hunt, who is the Executive Director of FREDLA. Pat has decades of experience as a family member, as a family leader, an advocate, a trainer, and an expert in family engagement. And with that, I am pleased to turn over the presentation to Pat.
Thank you so much, Jane. And I join Jane in her excitement of the fact that so many of you have joined us today. So I just want to say a big thank you for taking time out of your busy schedules to join us. We appreciate it. So one of the underpinnings of a system of care requires the meaningful engagement of families. We know it's often overlooked during the process of developing all the other pieces that needed to be developed. So while our agencies sometimes develop infrastructure, hire staff, make sure there's the existence of a nice network of services available and adequate to meet the needs of children, youth, and families. Boy, that's a dream, huh? Sometimes focus on this goal of engaging families is left until a bit later, which is unfortunate because it's a core piece of sustainability. You know, families are the constant, and so if we engage families early on, we can really get a good return for our investment on that. So as a result of ongoing paradigm shifts, policymakers, researchers, and practitioners really increasingly understand family engagement as an evidence-informed best practice and an integral component of the ideal model of service delivery. That's early on. That's not even to speak when we talk about one-to-one in the service delivery arena. There are other arenas we're going to talk about today as well. So families define their members. Each family is unique, leaving its members to be the only ones to define it in their way, from their culture, and through their truth. For children and youth with mental health needs, the definition of family is often complicated by changing circumstances that propel their journey among various living arrangements and often throughout other systems. So if you have downloaded or will download a presentation today, this is a really nice way of looking at families from Polly Arango, a family advocate and co-founder of Family Voices in New Mexico. I think this is a powerful way to describe families. So take advantage of the handouts as well. So I think as we spend time thinking about how to engage families, if you get nothing else from today's discussion, really if we begin our approach with a simple question to families, like what has your experience been in engaging in XYZ? What has that been like? Because I think therein lies the answer to why families may not be engaged or be excited to be engaged or even be open to being engaged. And so sometimes we have to ask the question in a different way rather than will you or are you interested in or could you, but to really say what is your experience been? Because if it's been a negative experience or if they have a history of disappointment or feeling negated or invisible, they're probably not too excited to step forward and participate now. So families are sometimes the only constant in the equation for children's mental health. So the children's mental health landscape includes ever-changing direction in state and federal funding and policies, workforce turnover at state and local agencies, new MCO, ASO, whatever contracts happen day to day, and staff and leadership are all variables that influence families. Families are the constant. So we have practitioner turnover, we have agencies that open and close, we have families moving from location to location. So families are the constant. And successfully engaging families requires us to go above and beyond relationships. While it relies on relationships, it really calls for policies, protocols, and processes that encourage support. And support's a big piece here, and sustain an investment in family contribution. So what is engagement about? At a practical level, engagement is about families feeling welcomed, their insights valued, and knowing that their contributions inform the decisions being made, that their voices create positive change. So it's about motivating and empowering families to recognize their own needs, strengths, and resources, and to take an active role in changing things for the better. Engagement is what keeps families working in the long and sometimes slow process of positive change. You have references at the end of this presentation. So this holds true whether this is in families participating in their own family services or collectively to impact access and quality to services. So at those sort of systems, agency management systems and policy levels. So what do you need in order to engage families? We talk about it like it's really an easy thing to do, and it's not. It's hard work. And I'm excited that we have so many people registered today who are interested in this, because I thought, how many people will come out to talk about engaging families? And it tells me that not only is the topic relevant, but that some of you may have some questions at the end or need further information from us in your quest to continue to do this to the best extent possible. So it requires a combination in a delicate balance of patience and persistence and encouragement and the things we talked about a slide ago. We're going to talk today about strategies for engaging families in 3 levels. That would be the service, the management, and the policy level, and explore examples of each in order to be successful at any of those levels. There are some overarching areas that require special attention. One of those is building relationships with families and family-run organizations. Family-run organizations are a wealth of expertise. They are naturals at this and can be your best allies in accomplishing the work that you're trying to accomplish. A welcoming environment, actively listening, and exploring the family's area of expertise and interest can help ensure that families are engaged in things that are meaningful to them. So you have to know a bit about the families, and you think about the questions. The question I posed a minute ago, to have that level of dialogue, because I think it's easy to have a false expectation of how we can engage families. And we need to meet families where they are and for whatever they can offer, however they're willing to offer it. Knowing that they will be in an environment that's free from judgment is important and permits families to share their ideas and their experiences and their skills, and helps encourage them to take on new risks and responsibilities. So when you talk about the leadership growth that can happen as a result of engaging families, those items are really key. So helping families grow into leadership roles really begins at hello. My name is. It's nice to meet you, because that's how you cultivate the relationships and the growth. And family-run organizations play a key role in preparing families for effective engagement in the development of their leadership competencies and in providing the opportunity to apply those skills, not only in your work, but maybe someday in national work, in the work of partner agencies or community organizations throughout your state. And providing supports to facilitate family engagement really require that sort of tangible and logistical resources to make engagement be effective and even possible for families. And we'll talk about a little bit of those examples later on. So translation, when I talk about tangible and logistical, I'll give you an example. I was on a committee once where this woman asked for things to be, all of the printed material to be in a larger size font. And it really required the group. She had asked so many times, it really required the group saying, oh, we can't have this meeting today because, Doris can't read these materials. And we said that once, and then people began to deliver things in larger fonts. So it's about making it really be available for everybody in the room at the same time, so people can be prepared to fully participate. Because if you can't read things that you're asked to make decisions about, that's pretty insulting and impossible. So particularly advisory groups and policy tables may want to think about developing a chart of the desired family experience. Many times a family is people who don't work in family organizations or work closely with families all the time may think a family is a family is a family, but that's not so. We have families with lots of diverse experience in multiple systems, with lots of backgrounds, other complicating factors. There can be children with additional health factors that come into play. Even though we may be talking about behavioral health today, we need to really think about the experiences of the broad group of families. And so being able to make sure that you have full representation is really important. And it's also important to be prepared to prevent groups from experiencing inertia. And I know many of us, probably all of us, I guess if we did a poll today, we'd know how many of us, but I bet a lot of us have been on groups where we meant like, is this the best use of my time? And so I think helping, keeping material relevant to families and helping families be engaged in designing what happens in that group is really critical as well as addressing turnover. And when families need to leave a group, to keep the door open and to help them find other possibilities where maybe their voice can be better used. So though it may seem complicated to know where to find the degree of family experience you're looking for, there are lots of ways to reach families to solicit their input and feedback. So there are planned and incidental ways. I mean, how many times have I met someone at the car wash, at the supermarket, whatever, you know, we all run into one another here and there all the time. So those are the sort of incidental ways. The planned ways can include sponsoring discussions or focus groups or community forums, attending conferences and workshops, doing outreach through other arenas where children and families are, such as schools and provider organizations. And number one, you want to reach families, go to family-run organizations. And I'm sure most of you on the phone already know how to do that. If you don't, feel free to reach out to us after this, and we'll direct you to family-run organizations in your area. So genuine family engagement is embedded in the work of all staff members, management, and systems in this ideal world, in an agency approach. So thinking about that, it requires a top-down and bottom-up approach, so family engagement permeates the culture of systems, organizations, and programs. And positive outcomes are more likely to be achieved when family engagement is as systemic as that. So when you think about if someone's going to be engaged in the work of your agency, you may want to have peers do outreach. You need to be willing to accept families from whence they come. Do they have time to participate on a board meeting? Do they have time as an employee of your agency? Do they have an opportunity to influence management decisions? And to really spend time with families discovering their preferred method of communication. So once you think about the range of parent experience, if you're thinking about, in some of you I'm sure come to this discussion thinking about, well, we have an advisory group, or we have a committee, or we want insight on policy decisions. If that's where you're coming from today, once you really think about the type and range of parent experience best suited for the task, it's easier to contact families for their participation. So meeting families where they are is really simple when it comes to physical location, but it requires more than one conversation to find out where they really are in terms of their readiness to engage in the types of things that you're talking about. So recruitment is not a one-and-done cup of coffee. It's really about ongoing conversations, helping people learn, sharing with them the kind of work that you're doing, finding out what topics are exciting to them or are of interest to them, and really understanding when people say, you know, I really don't have it in me today. I'm tired. This is what's going on with my family. And leaving the door open because, you know, being then ready to help them find resources. So you want to connect them with family-run organizations to find the resources to support them, and then be prepared for them to reach out to them again, and invite them to reach out to you if the time gets better for them. So, realistic expectations around families, tangible and logistical support, and access to peers. So families have lots of competing demands for their time and resources, and they need to know up front what the expectation is. I cannot tell you how many times my experience has been, we'd love you to serve on this committee, and it meets once a quarter or once a month even, and then down the road you find that they really want you to participate on 4 subcommittees that meet in between all those meetings. So really being upfront with families about how you can support their participation. In a few minutes, we'll talk about strategies in various arenas. So having a conversation with families up front to decide the extent of their engagement is crucial. So recognize and celebrate the family's strengths, growth, and accomplishments. When families feel valued, their efforts are appreciated, their insight, heard and respected, and they're embraced as part of the solution, they're more likely to stay engaged. And not everyone, as it says here, has the desire to become engaged in leadership activities. And I say even if your accomplishments may feel small, it's important to pause and say thank you and to recognize and celebrate what you have accomplished. I think that keeps everybody coming back to the table. Families are not the only ones who will be glad to make a return engagement if they feel appreciated. So the key arenas we're going to talk about today for family engagement are in service, and that would be families receiving services and families who are agency staff, in the management arena, and in the policy arena. So in each of those areas, we're going to have points to ponder, strategies, and examples for you. So in the service arena, families care about having we know this. We know families care about having a say in their child's treatment plan. How does that happen? How can you support that to happen? Do they feel comfortable enough? Are there pre-discussions that need to happen? Is there a parent-peer role to support them to participate effectively? The quality of the relationship between service providers and families influences treatment engagement dramatically. Not enough can be said for the importance of collaboratively working together toward a common goal. So early on conversations, if you're a family entering the provider arena or a provider who's spending time with families, then to have that conversation. What is it that we have as a goal, and how are we going to work together to get there? And I think we also, when we work collaboratively, we also have to be open to being comfortable, to disagreeing with one another, and finding a point of agreement and hearing one another about why it's not working and what can we do to change this, right? I don't necessarily think that it's always kumbaya. It is not. It has not been in my life. I doubt that it is in everyone else's. So being able to disagree, and sometimes being able to ask other people to take on that role, whichever role it is. So families are likely to withdraw from services if they feel excluded. And a family's worldview and cultural beliefs can affect their engagement, and we have to respect that. And as family organizations, we have to respect that. And oftentimes, people come from cultures where families keep their problems or their ideas or their opinions to themselves, or in not far from where I live is a community where, you know, women they're not the people who speak up. The males are the people who speak up. And so you really have to think about who you're talking with and have those questions, and have people on staff in your agencies as well to think about that and be prepared to respond to that. You know,
Hey, Pat.
Yes.
This is Jane. I'm going to jump in for a second.
Please do.
And add about helping families understand the process and the language.
Exactly.
I recall feeling so intimidated to even speak up if I did have an opinion, or even was asked if I had an opinion, and felt like I don't really know enough to be able to say anything. So I think assuring families that their questions are welcome, they're free to ask for clarification, and that their voice is important. I think that's also helpful.
Absolutely key, and I think that outreach and that early conversation with families needs to be all about that, Jane, to make it be successful and to make people feel welcome. It isn't just how is your office decorated that makes people feel welcome, right? It's listening to them, it's asking the right questions, it's respecting what you hear. And sometimes families aren't really happy or excited to be engaged because of past experience or because they have fear. They don't know how the information they share is going to be used. So that's why it's really important about the process. And language is a huge, huge area because I think it's a deterrent. I think families who go to, for example, a policy table or an appointment, and all of the language is clinical, and it's not translated to how it applies to the family and how it applies to the youth or their child. Just people do not get what they need from those kinds of conversations. And so thinking about how we present information and helping people be prepared is really key. So some strategies around families receiving services are to acknowledge and respond to what families say they need. And we're talking about as members of the team for their own children. Provide information to make informed decisions about care. Information isn't, hi, here you are, and hand it to you. It's about you have it ahead of time so you can make a really informed decision. So you can do what I do every day. You can Google, you can reach out and have a conversation with somebody else who may have had a similar experience. You can do your homework. And to tailor those services to meet the family's needs. To understand possible barriers to engaging in developing solutions. Sometimes we are our own worst enemies. If I get up and I have a huge agenda ahead of me for the day, I may not pause to ask the simple question I should have asked. And that is, what would help you get to where you want to go? And to work collaboratively around those expectations we talked about earlier, and providing support. And family-run organizations are really the key here to helping other people, I think, understand what it is like for families. You have families in your communities you could get great examples from. If you open up the opportunity to have that conversation, I would bet your family organizations already have a lot of this information for you. So engaging in decision about their child's care and ensuring continuity, providing key information to inform treatment goals and key elements of the plan of care. Nobody has some of that key information any more than families, and if they're not engaging and sharing it, you've got a treatment plan to doom here because it's probably not going to work. It may have been tried before, or there are other extenuating circumstances you don't know about. So families playing a key role in identifying challenges and quality issues as well. Anybody else want to weigh in from the Fredler team? No? So families who are agency staff. So an analysis of data from Barfield in 2006 indicates that children whose parents receive parent support services have better outcomes in terms of residential status, law enforcement contact, academic performance, and school attendance. So we also have lots of other information as part of this presentation, and you'll find that in the resource area. But there are great examples that and studies that back up what we say here. And so it's really key to have those families on your agency staff who are peers to support other families, right? And if you engage them in developing those kinds of tools and processes and forms and policies that your agency uses, it will be so much easier for the families that you serve, and they'll be so much more responsive to these opportunities to be engaged. You need to provide clear expectations to agency staff as well, and to provide training to support family staff to achieve program goals. And I can't emphasize loudly enough supporting the supervisor knowledge and skills. Do we have anybody on the team who wants to speak to that?
Pat, this is Jane again. I wanted to give an example of engaging families and developing agency policy practices and tools.
Great.
And I worked with a provider who enlisted families to really help them with their policies. And one they came up with was even looking at the definition of family engagement, and this actually speaks to a point that you made earlier, and that is take into consideration all that's going on in a family's life. And so they did not define family engagement or measure it, shall I say, in terms of, how many families came to the pizza night or how many families attended a meeting. They looked at each family in terms of how much could they do. And for some families, that was getting their children to school every day. That was a win. That they really considered those families totally engaged. They were working to get their families, or to get their children to school, to complete their homework. Whereas there were other families that could do more. So using family engagement as an individual measure of what each family can do, it speaks to the, again, looking, not all families are the same, as you said in the beginning, and even as the definition of family relates. And so the same holds true for engagement. And that's why having families involved in developing policies and practices, it was eye-opening for the agency, who always looked at family engagement, is that we need to get families coming to the pizza party. We need to get families coming to the support group, rather than looking at each individual family and what was their capacity for engagement.
Exactly. Thank you. That's a wonderful example, Jane. And data from several states documents that peer support has led to a decrease in the number of missed appointments with providers. So when families are engaged, they participate in appointments more regularly. The use of high-end care, such as out-of-home interventions, is decreased, and the stress level about being able to parent their children also decreases. So it also conversely has shown an increase in attendance and performance at school, and the parents' practical knowledge about resources and care coordination. And there's a model in Kansas for parent peer support workers that has also demonstrated stronger community connections, reduced antisocial behaviors, and less likelihood of recidivism in juvenile justice and residential settings. So lots and lots and lots of compelling reasons to have families who support families, but to really engage them in all aspects, considering particularly the agency policies, practices, and tools, because that's what the bridge is going to be to getting families engaged. Unless that works, they're going to just see what they've always seen, heard what they've always heard. And Jane, I'd be interested to know when they began to use these, did they get any feedback from families about the change?
They saw dramatic change because the families didn't feel like, well, first and foremost, it was eye-opening to the organization, to the staff, like, oh, we need to be looking at family engagement totally different. So the change in the environment, and as you say, providing clear expectations, it changed the expectations around family engagement, and not by counting numbers of families, but by looking at each family. And it took a lot of the stress off of families feeling, they're not going to look at me like I'm not engaged if I can't or don't come to the pizza party or the support group or the committee meeting. It took a lot of stress off of them and hence made them feel much more welcome in the organization.
That's wonderful. Thank you. So examples of families who are agency staff, roles they can play, things they can do, how you can apply their skills to help to continue to engage other families who are being served by the agency, peer welcoming and intake, helping with system navigation and care coordination. That really key issue we've been talking about the support and preparation for engagement in child-serving systems, such as child welfare, juvenile justice, and education, and really informing agencies' processes, which Jane, I think, has just done a great job of describing one example of how that can be effective and how it can be applied. So thank you, Jane.
This is Melissa, and I just wanted to share that I think another area that is really, really beneficial for agencies to consider engaging families is in hiring practices. And by engaging families as they interview and make hiring decisions for providers within the agency can make a critical difference in those providers' ability to engage families, and it really helps the agency look at a set of capabilities, personality traits, and qualities of who they're hiring from a very different perspective than they may have typically approached it from. And I know that for us, one of the things we did was had families that sat in on all of the interviews for the mental health agency as they were hiring for home-based therapists, wraparound coordinators, those kinds of things. And the agency saw a significant difference in the retention of those staff over time, and also the relationships between families and those staff as a result of, and they reported that they hired people they might not have had they not had the input from those family members on those hiring committees. So I think it's just another example.
I think you're absolutely right, and it should go as early as identifying the role of the staff, developing the job description of the staff. They really should have the insight. What's the purpose, what's the function, what's the staff going to do, who are they going to work with, how's that workflow going to engage me, right? All of those kinds of discussions are key. Thank you. Important point. I appreciate it. So next we're going to move to the management area. maybe. There we go. So some of the points to ponder really are about, I think, if we just simply think about good business practice, to use or to include product users in the design, development, promotion, and quality feedback of anything. If you think about a product like Nike, right? Nike, who started selling basketball shoes out of the back of a station wagon. Does anybody still remember what a station wagon is? They have now shifted their approach because they used the insights of the people who were using their products, and they listened to what they needed. They now offer all sorts of gear and apparel, including bodysuits and dresses and socks and all sorts of items, and they market themselves not only under the Nike brand but under other brands as well. So if we think about how that translates, how simply using the insights of the people they were hoping to serve, right, to gather information, that translates really well, I think, to the work of families and engaging families, and the importance of getting that information in much the same manner. So families of children and youth giving feedback about the services they receive and the systems with which they're involved can help shape those kinds of changes and expansions to really meet their needs. And instead of one type of shoe, it may be several. So agency leadership can reinforce the message that families should be engaged as full partners in decision making. And they can do that in lots of ways. And I think we've talked about several of them earlier when we talked about the family staff, but to get that as part of the set of values for family engagement reflected in the agency's vision, mission, and goals. And a study of 37 mental health agencies, family participation in program evaluation increased both the amount and the quality of data collected. And that's probably because we had some peer-to-peer stuff happening to collect data. So the kind of leadership buy-in that's required from management is crucial. Leaders can ensure that family engagement and values permeate the organization in a number of ways. So you can embed them in corporate mandates and policy. You can hire staff with family engagement experience. You can provide opportunities for staff to learn more about family engagement practices and modeling it within their own work. So developing those organizational policies and job descriptions and things. So when we talk about management, management has a responsibility to model it as well and to invite family voice to participate in management decisions. That's a lot of different decisions. So families who participate are more likely to be successful, which means the quality of your services go up, and families will stay in services because they do have a voice. So some of those areas we just talked about are on this slide. We engage families as trainers and co-trainers, support them to translate agency materials, trainings, language to include family examples, and to use family-friendly language, to provide information about fair hiring practices, and ensure families reflect the broadest collective experience. This is just kind of a recap, but reminding management, the management arena, that this is important everywhere. So some of the management examples would be engaging families as part of quality improvement processes, evaluators, trainers, advisors in selecting personnel, co-drafters and reviewers of RFPs. How many times do RFPs get responded to and the family role may be identified in there, but the family hasn't had anything to say about the RFP? And to help them, to support them in being liaisons and administrators as well, to take on management roles. Whoops, that jumped too. So we'll take a minute and move to policy and system decisions. It's important to have families of various cultures and diversity and experiences in policy activities. How many times do we go to the policy table and they've had a family there or two, and they've been, not saying this is all bad, but they've been the same people with the same experience, the same lived experience for a long period of time. That doesn't mean their insights aren't valuable, but it also means some fresh insight needs to be included. So, you know, people get sometimes very comfortable in their seats, or their lives change, and they may not pay the same attention as they did early on when they joined these policy and system groups. It's really unrealistic to expect any one family member to represent the experience of all families. So it's unfair to the individual involved, and it undermines the voice of families in general. So the real work comes because families sometimes may miss meetings or conference calls due to issues that emerge with their children, or the systems that serve them, or life just happens. So it's really important to engage several families. You know, remember, the job of a family early on is to have one seat if you're the first family ever, but you're supposed to put your purse or your coat on the chair beside you and save it for the next family that's coming on board. That's how we should think about this as we engage families to participate in these decisions. So if you engage several families with diverse experience in each group or initiative, you can help them benefit from the support of one another for their full participation. It creates an environment that says loudly, we welcome families new to the group, and it provides a collective view for the work rather than feelings of tokenism that can happen when you're the only family there. And groups also benefit from informal orientation and mentoring that happens when families connect with one another. So when we have a full complement of families informing the work, significant family input is possible when one or two families are unable to participate. So if you have somebody who's facing challenges from time to time and being able to participate, they don't have to feel like they let you down. You got it covered. And so really, I know it takes time and effort, and you know, a piece of what Fred will be doing in the very near future is providing some consultation and assistance to groups and policymaking bodies who are, you know, how to get this best work to happen and include families. When we think about, yep.
Well, it's Jane again, and I was just going to jump into your point about, you know, families, some seasoned families holding positions on committees or whatever, and everybody feels very comfortable that person has the history, and they feel, and the importance of bringing on new families with adequate support to do that, but also reaching out to families who cannot be at those policy tables and using other mechanisms like focus groups, like surveys, like listening posts going out into communities, getting family-run organizations to help with that, so that the voices of families who cannot be at those decision-making tables in those chairs, but their voices are equally important and they need to be heard as well. I mean, that's another form of engaging families, but it's a way that accommodates the capacity of a family to participate. Those surveys, focus groups, listening posts can be done in different languages at different times of day, using technology, doing focus groups on phone calls, so that there really are ways to get that family input in multiple ways.
There really are, and it's a responsibility of both the groups and the families on the group. If you have a family organization on the group, then it would be their responsibility to do that kind of collective information gathering and to bring data to the table to support their recommendations. And that's really critical. It's also critical that groups have what I call seasoned wisdom and current experience, because I think the seasoned wisdom can help to reframe some of the current experience that maybe newer families might not be able to frame in a way that translates to the kinds of decisions that need to be made. So their role as translators can be really powerful. And I think I know you're absolutely right, and I know many groups across the country, meetings are virtual, far more virtual now than they are in actually seats at the table. But I think when you're talking about state level stuff, you very often still see it as meetings at the table. So however, that can be supported and expanded to include people with call-in numbers. I know in some of the rural states, very rural states, a lot of times the meetings really include an 800 call-in number from members to participate, because it can take 5, 6, 8 hours to get across the state and be able to participate in a meeting, which is not the best use of anybody's time, really. So thank you, Jane, for those strategies. Instituting bylaws and develop targeted recruitment strategies based on the desired experience. And, very shortly we'll have a package of items ready for folks to draw from simply as samples. How you can think about that grid of family experience and what are you looking for, and how and where can you reach out. And when you say how and where, my first answer is go to a local family organization. That's a great stop and shop there. So being clear about the scope and authority of responsibility of the governance body. Many times people come to a governance body thinking, oh, I really can make this change and I can make this happen, and my child didn't get this, and I'm going to make that happen, and I'm going to be in the right room with the right person. And or my agency really wants to take on this new program, and if I participate in this discussion, I can make sure it's good. It's not as blatant as that, but I think oftentimes the undertone is there. And so I think being really clear up front about the scope and authority and the responsibilities, and to recruit multiple families and do the same no matter where families are engaged, appreciate and celebrate the accomplishments. This speaks to the entire group when you're talking about policy and systems groups, to really appreciate the hard work that goes on there. And a lot of people come out a lot of times for a lot of things, and, simply saying thank you or taking 5 minutes to celebrate, or sharing a snack, or taking the time to say how are you is really key, and to say thank you. Whoops, I went too far. You can't go there yet. So when we give examples of examples at the policy tables, it's about bylaws, and if you want family-driven work, it would be at least 51% vote on governing bodies. As members of teams to draft legislation or policies or recommendations. As members of a board, you know, really that sort of strategic planning that needs to happen, playing a key role in that. Raising awareness as speakers and participants in public awareness campaigns. Providing training and orientation for all of the members of groups is really key. How do you work together? I see lots and lots of policy groups and sort of fall down in their efforts because people don't understand or spend the time building relationships. You know, they jump into the work because it's busy. Instead of welcoming new members, sharing information about one another, about who they are and why they're there and why this work is important to them. So I think doing that groundwork up front is key to helping everybody stay engaged in the work. And to understand that when the group has an accomplishment, it's the group's accomplishment, really sharing the pain. If you're going to share the pain, you should share the glory, right? So celebrating those successes. And ensuring for families that there are peers on the group and who can be mentors or who will spend additional time before or after meetings to help translate that material or information or processes that the group uses. And using membership trackers, which is what I referred to before, to ensure that family seats are always filled. How many times I've worked with planning councils and other groups across the country when there are member slots that are not filled, and there are people who could fill them, but they get busy in their work and they don't make it a routine part of their work to go back and look at their membership and do the recruitment. So recruiting additional families as alternatives or observers who are authorized to step in when a member needs to be absent is crucial. Keeps the information flowing and keeps everybody current. Engaging in strategic relationships with family-run organizations is key for policy groups and decision-making groups, and providing relevant information in an understandable format. So I think we've talked a lot about engaging families and that it requires unwavering dedication and sometimes revisiting their past experience so we know what can help them now be engaged, to provide encouragement and support, and that all of you came out to this presentation today tells me that you've got this. So I'm excited about this. You can do this, you've got this, and we had to support you in doing this. So I'm going to take just a second, and I know Jane's got some other things she's going to talk about, to remind you of an upcoming opportunity at the 2020 Training Institutes in Orlando, June 29th through July 3rd. Early bird rates will close on January 31st, and scholarships are available and applications accepted through February 18th. And you can go to the Institute's www.theinstitute.umaryland.edu for more information. I just wanted to remind all of you on the call today about that opportunity.
So, Pat, I wanted to kind of circle back to your conversation about policy. And I think for families, that's probably the most, if you will, difficult, frightening, unknown area to step into. I hope I'm not the only one on this webinar that ever left a meeting in tears feeling like I said something stupid, that I was never coming back. I don't know. If anybody else has had that experience, please just say yes, so I won't feel so alone. But
Jane, I didn't leave in tears. I did not leave in tears, but I've created what I call thunderous silence in the room for minutes.
Right, right. So it's an extremely difficult. I see lots of yes. Oh, thank you, everyone. You made my day. It's very, very difficult, and recognizing that and ensuring that there is adequate support before. I'll never forget the first time I testified. I was clueless, and I left that driving home in tears and swore I'd never go back. And if I didn't have somebody just kind of, pat me on the shoulder and say, oh, God, I did that as well. So just being there to support families in the policy arena is crucial. It's important that they be there, but it can be so intimidating.
Absolutely.
Yeah. So, Pat, we got a lot of questions here, and I wanted to ask one before we get to the ones online here, and that is, I noticed we have people from a lot of different agencies, different age groups, and different roles. So is there any one thread? Well, let me begin by asking, in all these different settings, is family engagement look the same? We know it's different for individual families, but should it look different in different agencies? And people on the phone who are not on the webinar, who are working in, say, corrections or child welfare or medical home, chime in. And I don't have an answer to this, but as I saw all these different
that was great. That's great.
I'm wondering if family engagement, if there's a common thread, which I'm sure that part's true, but are there different nuances in different settings?
So let's read some of the answers as they come on.
Yeah, yeah. It should be directed to the need of the family group, right? I think sometimes there is a difference in engagement if it is an involuntary situation, which could be the case in child welfare or juvenile justice. And I loved a quote that one of our participants shared, and unfortunately I can't access it right now, about if families are engaged, it's not because of them, it's because the agency isn't doing something right. I don't know if we can go back to that. That was brilliant. And
repeat the question. Folks asked if you could repeat the question.
The question was, looking at who's on the call, there's people from many different agencies, systems, roles, and age groups even. My question is, does family engagement look different depending upon the setting? And conversely, is there a common thread throughout it all? And I was asking people to share their thoughts on that. And Melissa just put up the quote from me earlier about the significant barriers across all systems, and we need to be clear the barriers are not resistance. If we're not getting engagement, we need to be more flexible about how we engage.
Right.
Amen to that. But
so
back,
I noticed Wendy asked a question, a managed care follow-up, how is family input used and what changes? I think that's a huge discussion. I think it can be anywhere through the work of the governance governance group that's overseeing the local contract, all the way down to roles within the managed care organization. One of the most key things that needs to happen is for that organization, the MCO or whatever role they're playing, to have a person whose role is directly to be a liaison to the family voices in the community. And we want families playing roles in managed care companies. We also want them playing roles in provider agencies. We want them also to have the experience of the broad family voice, because I think it's easy sometimes to get stuck in your rut. Sometimes roles can be alluring, and so I think that's the other reason. Families also need family support from their family-run organizations and a liaison to that, so they can be supportive and helpful to the families who are working in their organizations, regardless of who they are, who the organization is.
Pat, we have a couple of other questions about, one I think we hear so often is how to find families to engage on a program and systems level.
Right.
Barbara Katz asked that one. Do you have any thoughts?
Well, I think my big answer is family-run organizations are comprised of families with diverse experience. Some of them are now doing training or are playing other leadership roles, and so I think, and I think also that depends on the topic. For example, if you're talking about legislation, and the legislation relates to families with a particular experience, then you need to find families who have that experience, and doing outreach through the family organization can help you link to those, and there may be lots of family organizations in your state you can reach out through. I think it's really important to do that, to also make it very clear who it is you're looking for, what type of experience you're looking for, because those families who have direct relationship to whatever that policy decision is can be most beneficial and most informative to you about the types of things that need to change. Also, the types of things that are working really well. Let's focus on the positive side too. We don't want to make policy decisions that lose what we have that are working well. And sometimes we don't always hear from folks about what's working well, do we? Sometimes, we have this little button that says, if you have a problem or if you have a complaint, go here, or, and so we also need to spend time on what's working well to help families be effectively engaged, because they can help with those decisions in multiple ways.
And Pat, one thing we didn't touch on, and is the topic of a whole separate webinar, is compensating families, providing support in the form of
right. And I think I intended that. Yeah, and I intended that in my comments about the types of support by giving them sort of overarching categories, and I wasn't certain how my timing was going to go, but you're absolutely right, Jane. And it's about support is whatever they need, and if it's a Walmart card or a tank full of gas or a stipend, or or you contract. So his particularly, MCOs and bigger policy people to think about contracting with the family-run organization to run those stipends and those sorts of things through, because many times you don't have the capacity to just simply do those things. And so all the more reason to want to have a contract with someone who can make that happen when it needs to happen. And many times our systems are built up. I'm going to go back to my first invitation to a policy group, okay? I probably I could have used some money for gas that day, right?
Mm-hmm.
But if I had to go through a process where I had to submit my mileage and do a reimbursement form and wait for a third agency to cut the check or whatever, that can take a month or two. And that's a long time for families. If we really want them involved, we have to work with organizations where they have accountability, where people sign in, where they sign their whatever, whether it's a mileage sheet or their, that they received the money. But I think that it's really important to make that be a fast process for families. Really important.
And Fridla has a tip sheet. We often get asked, well, how much should we pay a family? And we have developed a tip sheet on all of those aspects that if you can email us, we'll be very happy to send it on. So there's another very interesting question from Lisa Franklin. I'm currently working with a state organization that wants to use community as a generic term for all their work. I am trying to help them see that family engagement is potentially a subset of community engagement that has different qualities. Do you know of resources that would be helpful? And I know Millie has shared some resources or has said she would gather some. But I'm just wondering about the thought of community engagement and family engagement. Are they the same? Are they, should there be a special emphasis on family engagement, or is community engagement a generic term, cover it all? What would you say, Pat?
Would family engagement or community engagement, would one term cover it all? One term does not cover it all. Communities
I think we all agree.
Express outreach to families for family engagement. And Carisha, I see a comment up there. My role is family support in collaboration with juvenile probation, referrals based but not limited to. Low engagement, I believe families get tired of systems. What families get tired of is being let down and not having access to what they need. And sometimes we just have to walk them through that, through the process. I can't, just like we can't expect a first grader to concentrate on their schoolwork if they're worried about, do they have a home to go home to that day, or do they have a meal to eat, or is there going to be a parent at home to watch them when they get home? So we can't expect families to think about how they can participate and be engaged when they're burned out, when they're overwhelmed, when they're engaged with lots of systems, or when they've had broken promises. And so, and systems, so I think you're right about systems. They get tired of systems because the systems seem to sometimes let families down, or there's been broken promises to families, or they've received bad advice from somebody who said, oh, if you can just get your kid in juvenile justice, they're going to get those services they need, And so I think you're right, and I think it calls for a special kind of outreach from another family member who has similar experience to do that.
And many times families, and it might be even a higher percentage, have legitimate reasons to be burned out. They've been through so much over such an extended period of time, and they just are like, I can't keep doing it. And we have to recognize that and see if there are ways to support them. And, sometimes, we have to kind of carry people till they can get their strength back. And so I think acknowledging that to families, boy, you have been through it. You really, I applaud your courage. I applaud your persistence. Let's give you a break. Could we take a month off? Could you come back? Is there another way we could do this? would make it easier for you. Acknowledging it and really giving them permission for a period of time to say, I can't do this. I remember one therapist saying to me, you're on vacation for the next week. Well, would that were so. What she meant was that, I was not supposed to be responding to the calls from the school or the whatever. I just needed to step back. And so giving people permission to do that can sometimes allow them to get the space, energy, rejuvenation they need.
Absolutely. And I think we didn't use the word lived experience today, but Shannon's, I think if we can go back up to Shannon's point.
Yeah.
That's the difference. That's the difference in community and family engagement, because you can do community engagement, get all sorts of families there who do not have the same type of experience that we're talking about on this call today. So thank you.
And from Christy Corbin, and she chatted that we know that families don't always have the best experiences with system partners and vice versa. What are some tips on mending these relationships so families will want to participate and systems will want to include families?
Number one, ask families about their experience, respect their perception, because for them that was real, that was their experience. Doesn't matter what it looked like to me or you or anybody else, that was their experience. To really listen to that, to ask them to be part of the fix. What do they think would work better? What are their suggestions? And make them happen. And I think that team building I talked about early on that doesn't happen often enough in these, policy making groups particularly, people don't spend time on that team building up front and understanding one another's views and perspectives, and that we all come to this with a different lens, and how it's important to respect and hear and value the insights of everyone around the table, and to have the kinds of discussions that are solution-based and agree where you can agree, because that's how you advance the work. Success doesn't happen because we all agree today. We begin to agree one point at a time, right? So I don't know, is that helpful?
Sometimes, this is Jane. Sometimes it's a person rather than a system. And if they have had a negative experience with an individual, which often happens, and maybe there is a way to engage them with somebody else in that system so that they're still working and engaged with the system in whatever capacity, receiving services, sitting on committees, but may not have to deal directly with that individual at that time. And maybe that fence can be mended over time, or at least an acceptance.
I love that. I love the kinds of questions you're asking, because our training for committees and groups that will be coming out soon does address many of these kinds of things, and it's training and assistance that really facilitated process that really needs to happen with groups to get them to the point of working together. And that negative history or past history or experience, people need to be aware of that, and there are ways to manage that and have people be effectively involved. Mm-hmm. And it's been a painful process for those of us who've been through it.
Yeah. So Pat, I think we're, let's see, do we have any more questions?
Yes.
I'm looking at the time. Okay.
Yes, we have a question from Shannon. She asked, how do we support and recognize not only trauma, but as in a peer position, the secondary trauma?
Shannon, do you have an answer for that? Do you have suggestions for that? I think we have to recognize that. We have to, when we hire peers in our agency, when we hire parents in our agency or family members with lived experience in our agency, that's part of the onboarding. I think that's part of the agency staff training. I think the respect for that, the acknowledgement about that. Shouldn't we be that way about everybody who works with us? I understand the prevalence issue, but I think it's really important to understand that about people. It's just about people and how we work. And I think if we begin to think about it that way, it's just automatically part of how our agencies operate.
Yeah.
Other comments?
I love Jen's comment about transparency, and system partners need to let parents look behind the curtain where the decisions are made so they know the process and can advocate effectively. Good point. Lift the curtain. Yeah. Here's another question about a certificate of participation, and the Institute is not able to do that, but will send a confirmation of attendance. Let's see, where are we? Anything else here?
I like Christy Corbin's comment.
Yes.
As peer supporters, we need our professional support network as well as our personal support network.
Good point.
Yes. Lisa asked about the sample compensation information, and Lisa, there's a link on the resource slide in the slide deck so that you can access the tip sheet that has the information around compensation for families. It's supporting family participation in systems of care is what the tip sheet is titled. And if you download a copy of the slides that are listed in the file box below the chat box, you can access the link to that tip sheet. For anybody who's on a mobile device, please email us, and I'll put our info email in the chat box. Please email us, and we can send you a copy of the slide deck if you're unable to download it from your computer.
Mm-hmm. Okay. Any more questions? So
again, thank you, and I want to personally thank the FREDLA team for supporting this and this work today as well. Thank you.
Yeah. Well, in closing, thank you, Pat, and as you said, thank you to everyone on the webinar for sharing part of your day with us and for your participation through the chat box. Made for a very rich discussion. Shortly, at the end of the survey, at the end of the webinar, you'll be getting a link to a very, very short survey. It will take you 30 seconds, but your feedback is very helpful to us. We hope that you will take 30 seconds to complete it. And lastly, we really want to thank Tiara Brown from the University of Maryland, who is our expert technology whiz with the webinar, and we are always grateful that she provides such support to us. So with that, we will close out the webinar and wish everyone a great rest of their day.